So hello everyone, welcome to the YouTube channel MEDICO'Z Factory. So I myself Dr. JB Panchmatiya, and I will be teaching the topic that is well known, that is adrenergic drugs, through this channel. As you all know that the faculty from the AIMS will be teaching you through this channel. So I insist the students, those who ever are interested, those who feel that they are the weak in these certain topics, do watch the video and subscribe the channel. And first of all, if you are asking for the study materials, as a medico I have experienced that lots of different study materials are available in the market, but at a time you cannot purchase every material, and even if you purchase you cannot read it. So I insist that whatever the things are taught in the slides will be sufficient for you to present in the exam. So if you want to make the notes, you can make directly through it. Also, if anyone wants the note, you can ask in the comment sections. We will be providing the notes as well. So I wish that this topic will be helpful to you. And in case of any doubt, you can use the comment section as well. And entire topics of the pharmacology will be taught to you. General medicine will be taught to you. And that also free of cost. So take the benefit. So today's topic is adrenergic drugs, and it comes under the autonomic nervous system. If we talk, there are the different kind of drugs, different classifications of drugs, but in the pharmacology, the classification plays an important role in the every drug, not only the adrenergic, but in the every drug, classification is an important factor. So before starting this, we will start with the adrenergic transmission. Clear? So if we think that how the adrenergic drug works, what is the pathway to work? So first of all, to understand that the pathway is important to learn. You can easily understand through this that first of all, the tyrosine component which is available, you can even say L-tyrosine, but if you say tyrosine, it's okay. And then it is transported into the cytoplasm, this one area. From there, it converts into DOPA. So tyrosine is converted into DOPA via TH. Now, different kind of enzymes plays the role, and if you wanted to see the full form, you can see TH means tyrosine hydroxylase. From the DOPA, then it is converted into dopamine, and dopamine is abbreviated as DA. From the dopamine, it enters the storage vesicles, and in the storage vesicles, dopamine is oxidized into noradrenaline. Dopamine is oxidized into noradrenaline, and during that process, when the dopamine enters the noradrenaline, the inhibitor is reserpine. So it inhibits dopamine to enter into storage vesicles. So it plays as inhibitor. Do remember these all things because it will be quite useful for the preparation of the competitive exams like NEET, PG, next, or if you are giving anyone else. And the things which will be taught here will be helpful for the university basis as well, and for the preparative exams also. And now if we talk about noradrenaline, then it displaces from Na and it comes into the free area. From the storage vesicles, again it comes into the cytoplasm. But for that, calcium ion exchange is necessary. So the calcium ions exchange takes place, and during that it can split out. And the guanethidine, it helps is noradrenaline to enter into the cytoplasm, and the cytoplasm it enters into the synapse, and then it comes in the axon, and there alpha and beta receptors, it acts on the alpha and beta receptors. Now this much was so simple for you to understand. Now here two process takes place: uptake 1, uptake 2. What are the difference between both? When the noradrenaline is reacted on the alpha 1 and alpha 2 receptors, at that time the presynaptic neuron that is this area, or we can say also the synapse, their uptakes place means what this noradrenaline is reuptake by NET. What is NET? Norepinephrine transporter. It reuptakes and it again transports into cytoplasm. So noradrenaline, which is acting and which is on the free form, is again taken into the storage vesicles. That is known as uptake 1. If we talk about the pathway uptake 2, then it is the pathway for VMAT2. In that, again the adrenaline, noradrenaline is taken back into the storage vesicles. Clear? It is taken back into storage vesicles. So you can see this is the VMAT. Now which Na is displaced outside, that is again taken back into the storage vesicles by VMAT2. And the inhibitor for VMAT2 is also reserpine. And for NET, the inhibitor is cocaine and TCA. TCA means tricyclic antidepressants. It plays role as that. Clear? And metabolism of Na is taken by COMT, catechol O methyl transferase. So when we talk about the metabolism of the process of the noradrenaline, then it is done by the COMT, remember. Okay, and then it is also exchange. So this is the important one kind of the things that you can remember as the transmission, which will be helpful to you. How it is taken back, how it is released. This is the COMT where I have told that noradrenaline is there, and it is exchange. So this was all about adrenergic transmission. Clear? Moving ahead to the topic. Now we will be discussing about adrenergic receptors. So we have learned adrenergic transmission. Now different type of adrenergic receptors are present on the different organs in the body. Now if you know where the receptors are present, then and then only you will be able to understand the mechanism of action of drug. Because if you are asked in the exam, then you know that mechanism of action, adverse reaction, adverse effects, uses, contraindications. These all questions are asked is a long mark question, and these adrenergic receptors are even important for the Viva point of view. So if we talk for the adrenergic receptors, there is two types, alpha and beta. Alpha adrenergic receptors also subdivided into two types, alpha 1, alpha 2. Now we will see one by one that where all these receptors are present. And if you have any doubt, please ask. Alpha 1 that are present in the smooth muscles. Means body में जो कोई भी smooth muscles है. But if we talk specific, then the smooth muscles of prostate, uterus, ureter, liver. Here alpha 1 action is what? Contraction. So whenever the alpha 1 acts, then on the smooth muscles, then it does contraction. Means alpha 1 receptors का काम क्या होगा? Contraction कराना. लेकिन remember this is asked in the Viva as well as the competitive exams, that alpha 1 smooth muscles present on the GIT, gastrointestinal tract, at that time its role is relaxation. बाकी सभी स्मूथ मसल्स में कॉन्ट्रैक्शन होगा एक्सेप्ट GIT, उसमें अल्फा 1 जब एक्ट करेगा तब रिलैक्सेशन होगा. डू रिमेंबर दैट. नाउ इफ यू टॉक फॉर द ब्लड वेसल्स, it is present in the blood vessels also, then at that time it does vasoconstriction, contraction of the blood vessels. It is present in the radial muscles of iris, that is eye, and there it does mydriasis. What is that? You can see in the GIF, we all know this. And this was about alpha 1. Now if we talk about alpha 2, then it is present in the sympathetic nerve endings of the neurons. And what is the action of it? It decreases noradrenaline release. Do remember these all are the actions, and these all are is the location where it is present and what is its action. Now alpha 2 is also present in the pancreas, that is beta cells of islets of Langerhans. And when alpha 2 acts on this cell, what does it does? It decreases insulin secretion. Okay, and it is present in the ciliary epithelium as well, and it decreases aqueous humor secretion. Clear? It is in the eye where it acts. So this was about alpha 1 receptor and alpha 2. Now we will be moving towards beta, because beta is divided into 3 subtypes. That is beta 1, beta 2, beta 3. Now beta 1, first it is present in the heart. Now if it is present in the heart, then what does the beta 1 receptors will do? The action. Then it will decrease the heart rate. It will increase the force of contractibility, and it will increase the cardiac output. So these all are is the action. These three things will increase when beta 1 receptors will act. If we talked about kidney, then it increases the renin release. So beta 1 receptors are present in the kidney also. Now if we talk about the beta 2, then again it is present in the smooth muscle. Now remember that the role will be totally opposite. Whatever you have learned previous in the alpha, the opposite role will be in the beta of the smooth muscles. We have learned that it will do the contraction, then you can see that beta 2 will do the relaxation. So where it is present? Prostate, bronchi, uterus, ureter and liver. We have already seen previous that it was about contraction, here it will do relaxation. If we talk about blood vessels, there it was vasoconstriction, here it is vasodilation. Do remember this, that in skeletal muscles it does the contractions, and in the ciliary epithelium it increases the aqueous humor secretion. While in the alpha 2 it decreases, while in the ciliary epithelium it increases. It is quite comparable and easy to read. And beta 3, everyone knows it is present in the adipose tissue, that is fat tissues of the body, and it does lipolysis, that is breakdown of fat. Wherever the term lysis comes, do remember that it is breakdown. Clear? So it was about the location and role. So we have discussed transmission, we have discussed various receptors, its types, its locations and its actions. These are also important for the theory point of view, and you can directly make your notes from this. Now this is main, that is classification of adrenergic drugs. Adrenergic drugs are also known as sympathomimetic drugs. Do remember that. Now if we talk about the classification, it is classified into various types. So in the screen you can see the classification. First agent which it is classified is pressure agents. So we will see that first of all which drugs comes under pressure agents. So there is a classification which you have to remember and you have to write in the exam. So first is noradrenaline. Another drug if we talk is ephedrine. Then dopamine. This all drugs comes under pressure agent. Phenylephrine and methoxamine. So this was about the pressure agents, classification for the pressure agents. Now if we talk about cardiac stimulants, then what are the drugs? There is very much IMP topic, okay. If we talk about cardiac stimulants, the drugs, adrenergic drugs acting as a cardiac stimulants, then adrenaline, another isoprenaline and dobutamine. If we talk about bronchodilators, then it is divided into three types: short acting, long acting, very long acting. You heard na, Shaba, Laba. So first is short acting bronchodilators. So what are the drugs coming under short acting? And these bronchodilators are mainly for the asthma and COPD patients, we know na. So the drugs classification: salbutamol, levabuterol, procaterol, phenoterol and betoterol, isoetherinone, So you can write this way. These are the enough examples. So these were three: pressure agents, cardiac stimulants, bronchodilators. So moving to the next slides, again the classification, nasal decongestants. So what are the things coming under it? And in the previous topic, long acting and very long acting is remembered, I have said. So first we will discuss that. So what are the drugs coming under long acting bronchodilators? So long acting bronchodilators are salmeterol, formoterol, carmoterol, indacaterol. These all are long acting. And if we talk about very long acting, then again indacaterol is both. Remember this, sometimes it is asked in exam also, that indacaterol, then you can say it is both long acting and very long acting. And vilanterol and olodaterol. Okay. Now we will move towards nasal decongestants. So what are nasal decongestants? Phenylephrine, xylometazoline, oxymetazoline, nafazoline. These are the various examples. Okay. Now if we talk about the CNS stimulants, then amphetamine is a drug of choice. Dexamphetamine and methamphetamine. Quite handwriting is disturbing, but we'll somehow read it and learn it. Anorectics, that are the agents which are used in the like different things, enema and all. Fenfluramine, another is dexfenfluramine, and next is sibutramine. This is the three drugs that is used as anorex. And last is uterine relaxants, that is ritodrine, isoxsuprine and salbutamol. Remember this, that salbutamol is used as a uterine relaxant also and bronchodilator also. Sometimes it is asked in Viva also. So this was about the classification of the adrenergic drugs. If you have any doubt, you can ask in the comment section. Do subscribe the channel. Today we will be learning this much topic only, and these three topics are also very important. And please subscribe the channel. Thank you.